People got together. It's great.
But then I do it halfway.
Round of applause for no
It's over.
Yeah, those are the bears.
We're also on Facebook Live, so to make sure we time it right. Well, thank you all for coming in person. How special! Very excited to see actually in-person faces and not like the little boxes on a Zoom. Awesome. So we're going to talk about Shockwave today. I think I can speak for the whole team in saying that we are extremely excited about this technology. We've been training on it for a number of weeks now, and we've personally used it.
All of us now, right?
Well, Leslie.
Hold out.
Everyone else, and the results have been phenomenal. So we heard this from our colleagues, that's why we brought the machine into the office, but to experience it personally is super cool. So we want to talk about the science of it and then make sure all the questions get answered. Okay, so Shockwave, I think it's slightly misnamed because what it is it uses a tool that contacts the skin and sends sound waves into the tissue. And what that does is it breaks up scar tissue, something called fascial adhesions, and then it micro damages the tissue to stimulate stem cells. Does everybody know what stem cells are? Like any? No. Okay, so stem cells are the body's, are some of the body's most powerful healing cells. So they can heal any tissue, and so it's like getting a mega dose of exactly the right kind of cells to heal whatever the problem is going on there. They're very adaptable to be able to heal all different kinds of tissues.
They're your baby cells. They can differentiate into any cell that it comes in contact with. You have these little baby cells. You inject them into your liver, they will create new liver cells. You inject them into your heart, they will create new heart cells. So, yeah.
So let's talk about why we want to break up scar tissue or fascial adhesions. So this is a really great little picture to show how fascia or scar tissue can actually compress blood vessels and nerves, and it also will start to pull in your body and create an effect where you might have pain over here, but the pull is coming from a scar way over here. And so my best analogy for that is if you think about fascia, which lays between the skin and the muscle, and it should lay really flat like my sweater's laying here. But if we get an adhesion or scar tissue, it'll start to do this. And so you may have a place on your body that feels a lot like that. And that's actually what's happening underneath the surface. So as it starts to compress the artery, you can have downstream issues where you're not getting proper blood supply, say to a foot. Or if it compresses a nerve, then you're going to have pain issues.
Yeah, and they go hand in hand. Nerves and blood vessels, they're usually right next to each other.
So chances are, if you have pain in an area, you have some of this going on. So breaking it up will be a big part of getting healing to the area.
Question, what is fascia?
Yeah, so fascia is a covering that goes between the muscle and the skin. Also like in between muscles, and it kind of covers some of your digestive organs as well. And you've seen this, like if you've ever like prepared a piece of meat, like a steak, and you see like it's almost like a very light but fibrous tissue that kind of goes in between pieces of the meat. That's what it is. And it is really important. It holds your body all together. It's part of the support system. But when there's an adhesion or there's a scar, that's when you start to have an issue with the pulling and the tightening.
Yeah, there's no beginning or no end to fascia in your body. It covers everything.
It's actually pretty cool. It does these loopy deals that sort of keep everything in the middle. So there is almost no end to what this machine can work on. Yeah. Do you want to go through some of them?
Yeah, okay, so TMJ pain, especially for those clenchers. The shoulder pain, I think, is going to be really interesting. We get a lot of patients with shoulder pain, but it's the joints that really we're so far we're seeing a lot of changes with. Would you let me do my demonstration
Yeah.
right now?
So she was so cute. A few minutes ago in the office, she was talking. She had her third session today, and history is
I haven't been able to bend this right knee all the way since April of last year.
so. Of course, we've been working on it. She gets the best chiropractic care. Laser, her nutrition's
Acupuncture,
spot on.
nutrition, massage.
What don't you do?
I know, I've done it all, and I just haven't been able to move it. Just repetitive stress. I mean, for 17 years now I've been doing this on that table, right? For the same leg. I'm switching.
So after the first session, you did this.
I haven't been able to do this since April of last year.
Wow.
That was after first session.
Wow.
It even got better. I actually went to Scottsdale last week, and we did a lot of walking. I mean, I couldn't have done that for that as much walking as we did all around, Scottsdale.
So she said to me, I wonder what it will take so I can sit crisscross applesauce on the floor. And then she proceeded to walk down.
I couldn't believe this. This is so awesome.
That's pretty cool. And I have a similar, well, it's not quite as easy to see, but I've had plantar fasciitis problems on the bottom of my right foot for a couple of years now, right? It's that table and this, y'all don't see me, but this is what I'm doing over time. Yeah. And so if I kept it rolled out, it was okay. It didn't bother me too much. I could feel it, but it was okay. But if I didn't keep it rolled out, it was pretty painful. And so after first session, like 95% better. It was like I stood up and I couldn't believe it.
Yeah.
Now, over time, then you start to notice, oh, okay, so now I actually have this other like little secondary spot that's also contributing to it. So I think I'm getting ahead of myself, but the process is 3 to 5 sessions. You'll notice a huge difference. Most people, 91% of people, notice a huge difference after the first session, but then you uncover all the little secondary issues. So to get complete healing, it's usually 3 to 5 sessions.
And it's once a week. You have to wait 5 to 7 days in between.
5 to 7 days.
So you want to wait that long. You want the chance for that inflammation to kind of set up. You want to make sure that the stem cells are going to, especially my knee is still pretty warm, and I had it done at 12:45. So you want that to happen. I mean, look at all the things that you could do here. This is the coolest one right here. Is it post-surgical? Was it 2 weeks after?
2 weeks after.
Yeah.
Yeah. So you can actually use it in advance of issues too. So post-surgical, we're going to expect a lot of scar tissue. We're going to expect a lot of fascial adhesions to happen because anytime there's an incision, that's where those things start. So we can begin using it post-surgically to prevent those problems from happening in the first place. Let's talk about that one in a second. There are indications to use it for neuropathy as well. And going back, part of the problem with neuropathy is that the fascia begins to cut the blood and nerve supply to the area. So that's where you get like a burning pain that just won't go away. Feet or hands typically. And because this opens up the fascia and the scar tissue, there are indications to use it for neuropathy. Areas of calcified tissue, like if you always get grinding in your neck or you've got grinding in a shoulder all the time, that's calcified tissue. And that's fantastic for it. Range of motion issues, we saw that. Repetitive stress injuries. So if you're a sports person, you're always, hitting the ball, you're going to get certain repetitive stress injuries, and it's great for that. Basically any joint. Any questions on this, on uses? Anybody have anything not on the list that you wonder about?
So will it help bone like in the knee?
Yeah, that's a question I got earlier today. Yeah.
I think that I think it's worth trying.
Okay.
Some of the pain that happens there is not necessarily the joint, but the surrounding tissues, and those can heal. So I think it's worth trying. Mhm.
So that membrane that we're talking about?
The fascia.
The fascia. You ever smoke ribs or get a rack of ribs?
Yeah, that's what you,
Yes.
Yes.
It's
Yeah.
That membrane that's in the bottom of the ribs, if you peel up, that's the same thing, right?
Yeah. Yep.
So in effect, is this addressing inflammation?
No.
Okay.
In fact, it causes inflammation,
Oh.
but the right kind.
Oh, okay.
Because
Different kind.
Right. So you can have global inflammation that's like, you know, your sugar's out of control and your body's
Right.
just inflamed. That's the bad kind of inflammation.
Right.
But in order to bring healing to an area, the body has a little inflammation response.
Right.
And in fact, that's why the other global inflammation happens, because it's trying to actually heal your body as a response there. But in this case, when we micro-traumatize the area, say your knee, you would expect the knee to get a little swollen. And that's because your body's bringing those stem cells, bringing the inflammation to do the healing in that area.
but that's temporary, and it goes
It's
away.
temporary. Yep, it's temporary. So contraindications, we don't do this in pregnancy. We don't do it if you're on blood thinners. We don't do it if there's a pacemaker, if you have current cancer, or if you have a blood clot issue.
What about varicose veins that are really, really bad?
That's fine.
Okay.
We don't do it right over the vein itself, but we can work the area around it. And that's another issue where the fascia has gotten so tight that the vessels come to the surface so that they can still do their work.
Mhm.
So it's really indicated there.
So if it's not actually an injury, so like in my case scoliosis, that's not going to heal and go away and get better, it's just gonna be constant
Yeah.
inflammation and tension and all that, is that gonna help with that?
In a way, it is a repetitive stress injury, right? Because that shoulder always gets all of the tension. We are actually talking specifically about your case. I think in that case, probably what will happen is that you will have significant relief for some time, and then you'll need to go again.
Maintenance, just like with everything else I do.
Yeah.
Yeah, okay.
Yeah, and that's actually brings up an important point that's not in my PowerPoint, which is that if you have a repetitive stress that is causing this, that you're going to go and do just as much as you were before, then chances are at some point you'll probably need to address that again. So, like for instance, I probably will need to address my leg again in the future, and hopefully I won't let it get that bad because now I have a solution. But because I'm still going to be adjusting every day, I will probably do damage to that leg again over time.
Yes, for the blood clots, if a person has a blood clot in the leg, is it safe to use the device on the arm?
I think it's better just to stay away from it until the clot is resolved.
Okay.
Primarily because if you get blood clots somewhere else, there is a chance you get blood clots somewhere else in the body.
Okay.
There's a chance of that.
If you are an easy bruiser, you may bruise with this. Out of our team of 10, well, eight people have done it, or 9 people have done it, 1 person bruised. So it's not that common, but if you're an easy bruiser, you might expect that.
Same frequency for all? No other frequencies for deeper tissue?
Right, so it's intense. We start low. And
So you do have a variable adjustments on it?
Yeah, yes, yeah. But it's, even at its lowest frequency, or they call it the bar level, it's pretty intense.
But something more minutes.
So one of the indicators that we can use this for is cellulite, and we're not cosmetic here, we don't do a lot with just purely cosmetic things. But I did bring this up because if you have a lot of cellulite in an area, it actually means that you have fascial adhesions going on. And so if this is you, that would be something to have evaluated because it could be a warning sign of something deeper. Definitely have that evaluated. Does that make sense?
Does that mean my scraper can scrape cellulite away?
Yeah, I don't know. What have your results been?
I never tried.
I mean, possibly.
I don't have any myself. But
There's a lymphatic issue and there's a fascial adhesion issue. So if you can take care of those, then yeah, you can probably move the dial on it.
Wow.
Yeah. All right, so we have a video. So this is real time, so it's a little bit longer, but you can watch the whole process from start to finish, just about 4 minutes. Madison she actually had a really interesting issue, and we weren't sure if this would work well for her or not, but it really did. So she's had crackling in her knees that's really intense since she was a teenager. So she goes to bend down and I mean, it'll make you ugly. So we tried it and she's had really, really good results. So this was her first session. She was a little nervous. She knew it was going to be intense. So let's watch her here.
Put a stress ball in her hand?
Yep.
Get a stick by her.
Okay, wait, there was sound 2 minutes ago.
It wouldn't be it.
We really want the sound. Mute. No? Let me just try backing out of it.
Wouldn't be a HealthWorks production.
Return them in the middle. I just need to let people hold Zoe while they haven't done.
Oh, no.
I'll help them.
No, she'll have to be squeezed.
Oh, never mind. They might have bite perks.
I keep coming back for more, so, I mean, it's tolerable. It
What's
can
the
be.
pain scale?
I've got a high pain tolerance. I'm a bad person to ask. I gave birth to 2 kids without drugs.
What type of pain is it?
Well, it's not a nerve pain.
Okay.
So that is not a nerve pain. So that's a good thing.
Is it like deep tissue?
If you're stirring up, you're doing something to.
Well, you're creating a micro trauma. I mean,
Yeah.
if we had sound, it would be is what you're.
I'm not sure, and it's probably not worth continuing to fight it, but so the sound, we supply earplugs because, I mean, it is a sound wave going into the tissue, so it's pretty loud. So what we've done is we evaluated her knee first, and we decided where are the spots that we want to work on to help with the issue. And we've actually sharpied on her knee so that we know exactly what the route that we're going to do is. There's ultrasound gel, so a gel that goes on there so that the contact is solid and all of the sound waves go into the leg. This machine here is what does the work. And so there's actually, is that called a piston?
Yes.
There's a ball that shoots back and forth in there to make the sound wave. Thank you. Thank you, my engineers. And then you hear the noise. And as the sound waves are going in there, we start light, but even, like I said, even the lightest level is pretty intense, so you have to be prepared to feel the intensity of it. And then we try and work up. So we start at 0.3, we try to work up to 2.6 if we can. That's where the magic happens.
In the same session, you try to work out? Okay.
Depending on the person, if it's tolerated, we can go slower if needed, but that's the goal.
Yeah. He constantly asks for your feedback and everything. And like I always tell people when I'm adjusting you or stretching you out, don't be a hero. If it's too intense for you. I mean, right now, my hands are getting kind of sweaty just watching this. But it's only 4 minutes, and It works. I can do crisscross applesauce now, and I cannot tell you, I'm so excited about that.
I would describe it as a hurts so good.
Yeah.
Like if you could imagine like the deepest tissue massage possible, but it's actually not possible because a human can't do that, but the sound wave can. That's what it feels like, and most of the time it feels like you're like, ooh, that's good stuff.
You know what? CJ's gotten so good about like finding that spot, you know, using that instrument. When you roll over, you can kind of feel where the tissue kind of drags. It like drags a little bit, even sounds a little bit different when it hits. It's like, you know, when you do the Atlas adjustment, how, you know, we can always hear right when you got it with that funk, you know? It's similar to this, where when you get right over that tissue that really needs it, it actually changes the sound on there.
So there she was saying, oh, wow, it's not that big of a deal.
Does it feel pretty different in places like here versus somewhere with
Yeah.
like your neck?
Yeah, so working on my foot, I've had it on the bottom of the foot, which actually didn't move the dial as much for me as working on this inside part of my leg. And now here, the foot definitely was way more intense than the leg. But you think about that, like, you hear, like, if you're gonna have a tattoo on the foot, it really hurts, that sort of thing, because it's just a more tender area.
More nerve endings.
Yeah, more nerve endings there, things like
Less
that.
heat.
But the payoff
Yeah.
is incredible.
On that one that he was working. So what was her result?
So there she is trying out. If we had sound, you would be able to hear it.
She's still here.
Is she here?
She listened.
Madison?
How's the bottom side of that bus?
You have to
To
narrate.
demonstrate, I did my crisscross applesauce.
Okay, here, come in the middle. Okay,
So-
do the bad knee
This
first.
is the bad one.
Oh.
Get it? And then this is after 2. So I mean, it feels so much better. Like it can, there's so much more range of motion. But I mean, just the sound.
Is it weird having one limb that's like better and one
Yes.
limb that's not?
And I definitely need the next treatment because I just feel lucky.
Is there a reason you didn't do both at once? Yeah, there's a really good reason.
So you don't do them both at once because you want this spot to heal faster, and you need it to be inflamed. Like you need that body's response for the inflammation.
Yeah, that's really good. Yeah, so since we're making an inflammation response and we want the stem cells to go to the area, we don't want to dilute that too much by doing multiple areas. We want the body to work all in one area, and so.
Do we need to baby the area after the treatment?
You won't feel like you need to.
Okay, good.
No downtime.
Yeah.
That'd be weird.
And that's the beauty of it. Like
So I have a question though.
Oh, Madison.
Madison. Oh, I'm sorry.
So did you feel the difference right away going up and downstairs? I don't know if that was a problem
Yes.
for you or me.
It's kind of everything. Like even lifting my leg, like it'll pop lifting, but right here it feels
You feel the
it feels
difference.
amazing. But like going upstairs or doing like a deep squat, I couldn't do that almost at all.
Did the doctor say maybe it's time for a knee replacement at any point?
I did physical therapy on this knee. I mean, it was kind of hit or miss, but definitely this is better than any of the physical therapy that I've received for that knee. And that was just 2 treatments. Yeah. Sure.
That's awesome.
Any other questions? Thank you, Madison. All right, as you can see, she took it like a champ. So aftercare, this is where you were going. No downtime, so return to all activities immediately. So like if it's, you're a massage therapist and you gotta work your wrist, you can go right from this to a massage. Or, you know, you're gonna pitch a ball or whatever it is. One really important thing is you want to avoid anti-inflammatories of any kind,
Including CBD?
including CBD, turmeric,
There's one.
ice, no, including our cold laser don't want that over the area.
Do your Synergy products have anti-inflammatory properties?
Like the men's multi. And
Yeah.
I think those would be okay to continue.
It's so small. There's some turmeric in there, but it's a very small amount. It's
Same with
not-
the desiccated adrenal.
Yeah, the desiccated should be fine.
Okay.
How long do you stay out there?
So you stay off the anti-inflammatories for the course of treatment. So it's typically, because it's 3 to 5 visits, we're going right down the middle. We're saying we're doing them in little packs of 4. So for 4 weeks, you'd want to avoid, because you want that inflammation response. If you cut off that inflammation response, you're not going to get the healing to the area that you want.
And do you have to stop anti-inflammatories for a while before the treatment also?
That's a good question.
I would say no.
What was the question?
Because they have to be taken every day. The body utilizes them pretty quickly. So I would say just the day before your first treatment.
So that means serapeptase, proteolytic enzymes.
I'm not sure about those.
No, I think
Those are
you're okay on
different.
those.
I take a lot of them.
If you take a prescription anti-inflammatory, of course you want to go to your prescribing doctor to talk about that before doing this.
Okay, what about Tylenol?
Tylenol, no, you don't want to. You don't want to do Tylenol. You don't want to do ibuprofen.
Tylenol is not anti-inflammatory.
Let me get back to you because it's on my list. Yeah. Let me get back to you on it because it's on my list, but let me find out why. The stats on it are 91% of people feel immediate positive change, and that played out for us amongst our team as well. And then, like I said, 3 to 5 visits, so we're shooting right in the middle, and let's say 4, and then if we need to add 1, we do. That's how we're doing it in little plans here in the office.
So it's one treatment a week then, is that the max?
Yes, right, because you want that inflammatory response, you want your body to work on healing it, and you want to give that time to settle, and then then it's easier to find out where's the next spot that's contributing to this problem. So how we're packaging it together is 4-visit, 4-week plan. After the special is done, it'll be at a 20% discount, so regularly $400. With the seminar, we're taking another $100 off, so it's $300 for the 4 sessions. If you need a 5th one, you get that same 20% discount on it. Hopefully that will be you, but you're not gonna, have to pay just per visit, like on the per visit if you happen to need another one. The per visit price on it is $125.
Dee Dee asked, what about hot tubs or warm baths? Should you avoid that that after treatment?
Nope, that's fine. But no ice.
No ice.
Or biofreeze or anything like that.
No biofreeze, no arnica. When you have a session, we have a paper list of all the different things that you need to avoid, so you'll go home with that.
Okay.
Only drink water. Just drink water. Water only.
Just a water fast
Just
for the
water.
whole world. How many takers?
You have a 4, you don't want to do it more than
Once a week.
once a week.
Right.
Is there an issue if you have to miss one in the series or 2, if something comes up and you can't come in every single week? I guess it's recommended that you maintain that.
I think that would be something to talk about case by case. It depends on how long we're talking about. Like if we start and then you travel Europe for a month, that's probably not going to be a great scenario. I know all of you with your fall travel plans. But if it's like, oh, I miss a visit, it's going to be 7 days or 9 days instead of 7. I don't see that being a big deal.
If we do the seminar special tonight, but we're not sure which area we want to use it on yet, do we have as long as we want to use it?
Yeah.
Okay, and what about the cellulite package? Is there just a 20% discount on that one?
Yeah, it's the same.
Okay.
Yeah.
Of course, most people want that. Okay.
Yeah.
after surgery? How soon after surgery?
2 weeks.
2 weeks after surgery? Okay.
And if you have multiple areas that you need,
Yeah.
is that separate packages?
Yeah.
Okay.
Yeah, because you only want to work on one area at a time. So like if you want right wrist, left wrist, we need to focus all the attention on the right one, do that 3 to 5 sessions, and then the next week we can start on the other side.
But I mean, it could, that wrist, we could find that, you know, this area is contributing to that wrist too. So it's that one area.
Yeah, and so that's a really good point. So like with my foot issue, we actually worked as far up as right here. You know, so it's one issue region at a time,
Yeah.
and then we kind of try and unravel it.
What about body work on the area?
Probably light.
Okay.
Nothing.
Nothing's that's going to kind of move that inflammation out of that region.
Okay.
One, because right now, I can't pull my hands up to show you, but I mean, like I said.
So like Swedish only, light Swedish only?
Over that one area.
Okay.
And chances are it'll be a little sore too, and you might not feel like you want to work on that heavily either.
When I'm sore, I like rub it harder.
Are you pushing on a bruise?
So, a question, do we schedule these, like, with our adjustments?
We can do that, yeah. So a session from top to bottom, we schedule 15 minutes. The treatment itself is 4 minutes, but there's a little eval with either Dr. Taylor or myself. We mark up the area, figure out what's needed. CJ gets the machine set up, you know, gets the gel on there, goes through the treatment. And then there's just a little bit of, you know, like wipe the gel off. And you'll probably be done in something more like 7 to 10 minutes, particularly after your first one, but plan on 15.
Marion would like to know if you're already in pain in the area you want to use it on, should you wait until it stops hurting before you start?
No. My
Sooner
knee has
is
been
the
hurting
better.
for over a year, and I did it, and it's fabulous.
In fact, like if it's a sports injury or something like that, the sooner that you can start working on it, the better, because then you're working like on the pain problem, but also you're preventing the scar tissue and fascial adhesions from getting worse. Like a chronic pain issue, Dr. Taylor covered that pretty well. Any other online questions before we?
Not that I'm saying.
Any other in-person questions?
So you mentioned the global inflammation. It does not help that, but you mentioned stomach scarring. Would that be from surgeries, things like that, that it would help? Or-
Yeah. Is surgical scars?
Mhm.
Yeah. So anytime there's a surgery, in order for the surgery to happen, the skin is cut through, the fascia is cut through, muscles cut through, and all of that heals with scar tissue and adhesions.
So when just say your muscles typically work like this. When they cut through them, when they heal, they have to heal like this, so they actually will stick together, right? That doesn't have as much range of motion, does it? It doesn't have the elasticity it used to, it never will. But this does, it helps break that up a little bit better. And help me.
Really good questions.
So it actually, go ahead.
Well, I was just going to ask again about the special. So $300 special and then $400 regular, but if we need more treatments after the 4, is it 20% off for the rest of our lives, or just like for one more treatment?
Can you buy a package? Yes.
Okay, buy a package.
Well, for that time, for that area. So, for instance, like we were talking about before, like if you have repetitive stress, like 2 years from now, you may need the same sort of thing again. It wouldn't be 20% off, like for individual sessions. You'd want to go through and do the whole deal again.
So for a package.
Yeah, yeah. But we like to give a package discount for things, so that will continue to be something that we offer.
It's just the 300 is temporary.
The 300 is temporary.
Okay.
Is it just tonight? We can take payments and appointments starting tonight. We are going to extend the 300 until the 1st of September, whatever the next month is.
So fast.
It's gonna be December before we know.
I know.
You have a question?
I was just wondering about the fascia. Does it actually smooth it out? If it's wrinkled in any way, causing, scar tissue.
Right, so it breaks up the adhesion. So if we've got like a adhesion, so
Right.
it does that.
Very good.
Yeah.
So what about like a hernia?
Hernia is intestine. That's a little more difficult, I would think. Yeah.
Okay. If there's no more questions, then thank you all for coming. And Leslie is available to make first appointments and to and Madison. And we are giving away.
Yes, he's gonna be good.
All right. Here you wanna.
I've been playing with this the whole time. All right, I'll be the one. Yes. Thank you, a lucky person. Okay, let's see. Standing glasses. I can't say it. 857026. Yay!
Dr. Christie, we got one last question.
I need to talk with you about it.
Okay.
Betsy would like to know the difference between scar tissue and adhesions.
So scar tissue can be like also in the skin, in the muscle, and adhesions refer specifically to the fascia.
Perfect.
All right. Well, thank you guys very much.
Thank you.